relates to COVID positive patients. We track the number of positive cases, but we have to focus more on hospitalizations and deaths to see the impact on our economy and on our citizens. And so in New Jersey, the rollback plan, they gave them 14 days where they monitored the hospitalizations, the deaths, and the positive cases, and they did not reopen another phase until they saw 14 consecutive days. So even if they got to the 13th day and it was not on trend, they did not reopen. And the reason why we do that is because the disease does have an incubation period. So that's where the testing comes into play. If I go get tested on Monday and I don't have my results till Friday or Saturday, meanwhile, I've been to session and infected other lawmakers. I've been to dinner, and the disease just continues to spread. And so that's why it's important for us to implement those stay-at-home orders, making sure that our citizens are where they're safe, away from those who are infected. That's the first step to containing the disease. But also, when we look at our healthcare system, yes, we have capacity. We have about 20% capacity left for our ICU beds and our hospital beds. But what happens is it's exponential. So in Texas, they saw, say, 1,000 deaths over the first 53 days. Then 24 days later, they were at 2,000. Then 13 days later, they were at 3,000. So it just starts to snowball into a bigger effect. And that's what puts the strain on the healthcare systems. So not only do you have to manage the beds that are in the system, you have to manage the workers, the medical staff, and the facilities. And I don't think that we're prepared statewide for that, especially in our rural counties that don't have hospitals to get to. And so we would have to absorb some of that stuff as well. But the only way that we would make any advances in containing the virus spread and to prepare our healthcare facilities for what we have at hand right now is to make sure that we do contain the disease and we make mask mandates statewide. One of the reasons why we don't have widespread compliance is because people are confused. I do one thing in Nashville, I do one thing in Memphis, I do one thing in Weakley County. If we have different mayors giving different directions, we're really confusing the process for our citizens, and that's why we end up with the numbers that we have. And I think we can do a better job by making it consistent, the mandate across the state. Memphis, I know we're doing a good job. Nashville is as well, but it has to be enforced, and our businesses have to be monitored too. One of the things that happens is, our businesses aren't getting clear communication as to what the expectation is as far as social distancing, protecting employees and their customers. And so they're open. All they know is they can open at 25 or 50% capacity, but what regulations do they have to meet, and are we enforcing those regulations? And so if we don't want to burden the healthcare system, those are the components that have to be put into place in order to make sure that we're not caught with our pants down, to say the least. So I'm going to give it back to you, Jeff, to wrap up. You're on mute.
Sorry. Thanks, Katrina. And I think Katrina being, is working in the current situation that we're trying to avoid. And, I'm sure that there are people already who just think this is just a bunch of Democrats attacking a Republican. And at this point, I don't really care. At this point, we have to do what's right. And there are lots of Republican governors who are doing good things in this, right? I mean, you can look at Tate Reeves pushing back last night on some of the more knuckleheaded, herd immunity theories that are going around his state. You can look at Greg Abbott, who's, did effectively a statewide mask mandate in Texas. And frankly, I think there's lots of things that we appreciate about Governor Lee. I mean, I think that there's no question that Tennessee came to the testing situation before a lot of our peers, and that should have put us in a better place to prevent where we are. And this is not because we don't think he is capable of doing good things, not because we don't think he has done some good things. It is just a recognition of the reality that if we don't change course, we're in a bad situation in the state, and we are not going to be able to reverse it. So with that, I'll turn it over to y'all for any questions. And just unmute people if you want, Brandon. You're muted.
If you have a question, unmute yourself or raise your hand, and I will and go ahead and ask.
Can you hear me?
Gotcha, Sam.
Yeah, my question is, are you all willing to take responsibility for another economic shutdown? And I know the numbers that came in yesterday were pretty bad as far as revenues returning. If we go backwards, take another step back in phases, will we see another economic shutdown? Are you all okay with that?
At this point, we should have the tools in the toolbox and the knowledge to contain this virus without that shutdown tool. But if we can't, then I think we've got to do what we have to do to shut this virus down from spreading. I think the problem that we've had all along is that there are too many people who see the responding to the health situation and getting the economy going as if they are in competition. And that could not be further from the truth. And we're about to learn this in, all its ugliness in the next few weeks. If you do not contain this virus and people do not feel safe enough to send their kids to school, do not feel safe enough to go to work, then I don't care if you what you're technically reopening, you're not going to be able to grow the economy in the way that we need it to. That can't be the choice that we think about. I don't think that's necessary, but that can't be the choice.
One more thing. Do you all feel like this is just a situation where a lot of people still aren't taking this seriously? You've got the situation where you have these COVID parties where the guy, I believe, Texas maybe, where the guy died at age 30 after going to one of those parties. And just in kind of going around places in Tennessee, I get the feeling that some people still don't think this is something real. And where is that coming from?
Well, I think that is a real problem, Sam. And, I went to New York, and came back to the legislature, and one of the lawmakers asked me, so this is not a hoax? And I was just taken aback that, out of all the data that's there, everything that we see, we don't want to believe that it's real. It's real. And I think that does have a lot to do with the numbers that we're seeing. People don't really believe that it's real until it affects them or someone close to them. We just have to do a better job of putting it in front of them.
Hey guys, not sure. Can you guys hear me?
Yep.
Oh, okay, sorry. So one of the things that, somewhat to Sam's point, is we're talking about the mask mandates, and obviously a lot of this is based on the behavior of business owners and citizens alike. What tools does the legislature or Governor Lee have in his toolbox to enforce, let's say, mandatory mask wearing? Or is there any recourse, other fines, from fines to whatever, that can actually make this a reality to where, regardless of where you stand, this is something people will have to abide by?
Well, I think through the whole process surrounding the Tennessee Pledge, we've actually had a lot of people do the research about what the best health practices are. But it's clear that this is non-binding guidance that's being urged upon people, but not required. And I think it's also self-evident at this point that it's being interpreted and applied in wildly inconsistent ways across the state. And that sort of lack of seriousness of purpose, I think, can't help but translate into the lack of the community taking it seriously. And I think that you can see that in businesses where, you go at everything from businesses that are actually not allowing people to wear a mask to people that are, not requiring it and that are cheating the rules to the disadvantage of everyone else. And that's the thing, is like, whether it's young people on a, party bus in Nashville, or if it's old people at a Lowe's in rural Tennessee, people that are cheating the rules are cheating everybody from getting out of this. And we could do that through the legislature. We haven't. Unless we're going to have a special session to actually do that, then the only option is for the governor to actually give his executive order some teeth, and to actually try to make these things, real standards in Tennessee, as opposed to something from the suggestion box.
Good, thank you.
I've got a question. Y'all hear me okay?
Yep.
Schools across Middle Tennessee are going to be opening soon. Several counties reopening. I guess I should say all of Tennessee. We posed some questions to the governor about what is going to happen if teachers or students are diagnosed with COVID-19 in the classrooms. Haven't heard back yet, but wanted to know what you guys think about what the state should be doing to be guiding school districts as they're trying to reopen during this pandemic.
It's hard for me not to respond to this as somebody who's got a kid that's supposed to start school in 2 weeks. And, there is nothing that parents want more than for their kids to go back to school. And there's nothing that we as policymakers want more than for kids to be at schools for in-person learning. Like, everybody gets that. But as much as I'm dying for kids to go back to school, nobody's willing for people to actually die for our kids to go back to school. And if we're going to be putting our, our kids' grandparents at risk, or putting their teachers at risk, or, even if it's a small chance, putting, our children at risk, is not something that we're really designed to do. And, if somebody thinks that parents in Tennessee are going to send their kids back to school just because Betsy DeVos said so, like, they are going to have another thing coming. So, I think we got to clear away that, sort of context that, like, this is a mandate, or we're going to take away your money from the federal government. And this has to lead with how we are keeping students, teachers, and families safe. And if we can't do that, we're going to have to figure out how to do distant learning, because I don't think there's a different path. And if we really wanted, it would have been the right thing to focus all of our efforts on being able to go into this moment ready for in-person schools. But, like, we haven't done the right steps at this point.
Have you spoken with any teachers about reopening schools?
Hey, I can jump in on that one. Can y'all hear me?
Yes.
Yeah, I spoke with some teachers. As a matter of fact, I actually have family members who are teachers, and they are concerned because not only are they themselves potentially health risk or health risk averse, or not averse, but are more inclined to have potentially a more severe version of COVID, but they themselves are concerned about spreading it to others, and what that impact will be. So I've talked to some teachers in the community as well, and I know they're concerned. Shelby County is doing some sort of hybrid model, but regardless, teachers will be required to come to the classrooms and do the training from there. So I think there is some concern, but fortunately, at least in my end of the state, our superintendent has made it very clear that he's going to do what's best for the children, regardless of what bullying tactics are being suggested on a federal level.
That's all I got. Thank you, guys.
Thanks, Kyle.
We have.
Back to. Oh, sorry.
I was just saying we have a few other reporters who are unmuted. Please feel free to go ahead.
Thank you. I have a question about enforcement of mask mandates. I've spoken to a couple of sheriffs whose counties have mask mandates, but they've chosen not to actively issue citations for violations. If there was a statewide mask mandate, how would enforcement be handled?
Well, I think, go ahead. I'm sorry.
No, go ahead, Ramesh.
I was just going to say, I think that, again, that is something that if it is a statewide mandate, our law enforcement officials would need to enforce it. And I'm not talking about arresting people or anything aggressive like that, but certainly issuing reminders. And I think other states have actually have financial consequences if people don't wear masks. But I think it's an opportunity for law enforcement to issue warnings and also even give out masks. I mean, there are some people who don't have them, which is why myself and Karen Camper put together a Mask Up Memphis initiative that has been giving out masks. But I think also there are others who are just willfully not wanting to wear a mask because they just don't want to do it, or they think it's political, or they believe this unfortunate nonsense that your oxygen saturation rates go down or things like that. So I think the law enforcement has an opportunity. I mean, if they see it and they're saying they're not issuing citations, I think just like other laws or ordinances or executive orders that are passed, they would have to enforce it.
You know, I mean, one thing that I think gets lost in some of this mask conversation, you know, I mean, yes, I think there should be, like, there needs to be a pathway for enforcement, especially of egregious violations. But the status quo is, if there's not a mask mandate, you're basically pushing the decision making and enforcement down to the level of businesses who are desperate for business right now, trying to keep things safe, and people are coming in without wearing masks, and we're asking them on their own initiative to, like, push a policy that we as a state aren't willing to stand behind. And that's what's pathetic about it.
Thank you. And then another question on a different topic. In light of the 3 positive cases recently reported in the legislative community, would you all suggest further precautions be taken in preparation for the anticipated special session?
I would absolutely suggest that. I think we should be mandating that we wear masks on the floor and in committee. I think we can do a better job of distancing ourselves. And as far as even managing our own offices in the legislative class, we have to have some kind of leeway as to how we can still conduct business, but be safe and respectful of other people. We can't politicize people's health just because we think that it's hoax. And that's why we're in the situation that we're in. So maybe that will spark the conversation that says, hey, this is not a game. We need to be wearing masks while we're in session. So I'm hoping that's what we see when we go back.
And to Katrina's point, our staff members and visitors are required to wear a mask in common areas, and they are temperature checked. So I think that it would be hypocritical and counterproductive for members not to have to wear a mask as well. It's really, the people in Tennessee elect us and send us there to do our job. And it's really unfortunate that politics makes it potentially unsafe because we're all wearing masks and we're protecting those around us. But those around us are not wearing masks to protect us. And I think it's been confirmed multiple ways. This is not a political thing. It is the best policy to keep people safe. And you see what happened in Mississippi when 26 legislators now, including the lieutenant governor and the speaker of the House, now positive with COVID-19. I mean, we don't want our special session to be a super spreader event. And it's something so small that we could do that would make a tremendous difference.
Thank you.
Stephen Elliott, you're unmuted. Did you have a question?
No, thanks.
Anyone else? All right.
All right, guys. Thank you so much for joining us. And don't hesitate to be in touch.
Thank you.
Please feel free to follow up if you have any additional questions. Thank you much all for being here.